Just a quick question. I did meet with 2 residents over the past month who they had several concerns, but one of their main concerns was the mental health board and the funding. They believe that we're not doing the will of the voters when it comes specifically to the funding amount and the support that we're giving. And so I feel very proud of the work that this board has done, and the mental health board, of course, and President Avalar over the past few years, that we've been able to serve almost 1,000 residents, and that we're at a good level. We know this board is still growing and we're still trying to figure it out. But I just wondered if you could speak to, I guess, the funding and, those concerns. And again, I explained to both those residents, kind of where we were, and that certainly we can grow in the future, but this is where we are right now. But I just want to make sure everyone knows. And so I do have a follow-up question after that.
Well, I guess I could say, the original referendum allows for up to 0.15% of the total levy. I'm not aware of any mental health boards that go that high. Most are pretty close to where we're at, I would say. At least the ones that go through the property tax levy. We have some that go through sales tax. That's a different animal altogether. But I guess I would say, where we're at now, I can give a couple examples. My experience at Kane County working with the ARPA program, that's the COVID money that came in, is $103 million. And our first effort was to get $4 million out for a community support grant program. It was just it was supposed to be quick money. Get it to the mental health providers, the food pantries, and the homeless shelters. It took a long time to get just that $4 million going, let alone to finish it. It took about 2 years to get all the money sent to the organizations. But just creating the back end system to hand out $4 million took about a year. So it wasn't as easy of a process. Even though we had $100 million, it didn't make it go any more quickly because of that. I know Will County recently, they had a $10 million levy, I believe, last year, and they are seeing the same thing. It takes time to build the system, so they asked for less money this year. I think we are in a capacity building mode right now, so we're at $500,000. We didn't max out the amount allocated for a grant program this year. I know the original levy was about $1.5 million, came down to $500,000. The demand we were seeing isn't there as much because insurance is now covering mental health. And we got that direct information from our biggest provider, which is Family Service Association of Elgin, and they service the most residents of Dundee Township, and they said, we saw a big drop off occur once that law took place, was enacted, and then this year they asked for less money for the same services, for the same program than they did last year. So there is a bit of a changing landscape that we're trying to navigate. I think if we were to go too far, we would just have more money sitting in a fund balance, which we already have. So right now, we've got about $340,000 allocated and about $300,000 that's excess. That's in a fund balance that we're working on the programming, moving towards spending that money. So if we were to have another $1 million, it wouldn't really speed things up, so to say. It would just mean we have more money sitting, and now you have the potential of people bringing tax objections and things like that because you have too much money. So we're not planning on building any buildings. That would be a different story. Then we could levy higher, put it in a capital fund, and that would make more sense. But that's not where the board is at right now. So I think does that answer?
Yeah, and I just
picture.
Yes, definitely does. And just again, as a reminder to this board, we can go up and down as needed because PTAL doesn't apply anymore. So if we need to go a little lower, or higher, or much higher, we have that, which is great flexibility for us. But just again, I just want to be clear that if this board said, and the mental health board said, we want to do the full max, we want to do the will of the voters, which was for the full, you're basically saying you would not be able to spend it this year. In the future, absolutely.
I would say that the will of the voters is to max it out. The will of the voters is to say, hey, you can go up to that amount, but find out what is needed. Address the actual needs, unless we're going to build buildings and hire staff and things like that.
Okay.
And I did, in preparation for the tax levy vote that you guys passed with the $500,000 again, we could have gone lower because we do have a fund balance. But I gave you all that 3-year projection that shows, at the current rate of $500,000, assuming some of the programming ideas that we're going after come into fruition, we'll run into a situation in 2 years where we'll have insufficient funds early in the fiscal year. So, and that's just based on projections. We're not there yet, but that's kind of where we see what we're growing into. Again, that capacity building. So, we'll see where we're at this time next year. When it comes time to talk about budget and stuff.
All right. Any other questions? No? Okay. Thank you.
Thank you.